Confused about bone marrow examination? Let's break it down in this short video under a minute in crisp, clinical, and exam ready. As we all know, every bone has its two parts, a outer cortex and inner spongy medulla, which contains the marrow particles. Bone marrow examination includes two procedures. One is aspiration and another one is biopsy. So, for aspiration, cytology, and for cellular organization and architecture, we go for biopsy. There are two types of needles in case of aspiration. One is Salah's and one is Klima's. Salah's and Klima's both have three parts. One is needle itself, another one is stylet to prevent the blockage during the procedure, and the guard to prevent the overpuncture. For biopsy, we use the Jamshidi needle. As you all can see, it is a long, slender stainless steel needle with a sharp rocker, and a T-shaped handle is here for a better grip. Now, come to the examination sites. There are three preferred sites in case of bone marrow examination. The most common or the most preferred site is the posterior superior iliac spine. Another one is the sternum, but in case of sternum, we can only go for the aspiration. And the tibia is for the newborn babies. To perform the procedure, at first we have to do proper positioning of the patient. And in most of the cases, the most preferred position is lateral decubitus. After positioning of the patient, we have to go for the local anesthesia. And in the case of local anesthesia, we use 2% lignocaine and the dose will be 3 to 5 milligram per kg. Now let's see what are the indications of bone marrow examination. Now, unexplained anemia, leukopenia, thrombocytopenia, or pancytopenia, bicytopenia on peripheral blood smear, evaluation any kind of leukemia, myelodysplastic syndrome, myeloproliferative neoplasm, or staging of any kind of lymphoma, multiple myeloma, fever of unknown origin, suspected myeloinfiltration per any metastasis or tuberculosis, evaluation of under iron stores, hemophagocytic syndrome, or storage disease like Gaucher's, or last but not the least, the transplant evaluation and follow-up. Now, there are certain contraindications of bone marrow examination, like absolute contraindication are local any kind of infection at the local site of the marrow puncture or puncture site, and any kind of uncorrected coagulopathy. Other relative contraindications are severe osteoporosis. Patients are very uncooperative and unable to maintain any position, and hemodynamically instability of the patient, or the overlying bone lesions or any kind of bone disease, or previous radiation at the site of the puncture. Now, today our take home message is bone marrow aspiration is done for the cytology of the marrow cell, and in case of biopsy, we can know the histopathology. PSIS is the mostly preferred site for the aspiration or the biopsy. Salah's and Klima's needles are aspiration needle. Jamshidi is for the biopsy. 2% lignocaine is used for anesthesia at the local site. And please avoid the procedure if there is any local infection or uncorrected coagulopathy of the patient.